The doctor's company analyzed 1,215 malpractice claims filed on behalf of pediatric patients that closed from 2008 to 2017. These claims were filed against physicians in 52 specialties and subspecialties. The study showed that while risks in treating children varied depending on the patient's age, communication breakdowns between patients, families, and providers occurred in claims for pediatric patients of all ages. Inadequate communication resulted in physicians receiving incomplete information to make accurate diagnoses and failure of parents and guardians to adhere to discharge instructions. Communication failures also resulted in inadequate guidance for parents on conditions that required immediate care, thus limiting a physician's ability to treat a patient in a timely manner. This finding shows the importance of physicians providing detailed explanations to the parent or guardian regarding symptoms that prompt immediate care once the child is sent home, keeping language and cultural barriers top of mind when providing these explanations. One case study highlighted this important issue. A healthy female newborn was seen for well baby visits at 2, 4, 6, and 9 months. She received the appropriate vaccines. At the 1-year visit, 3 vaccines were given. The baby had received the first 3 pneumococcal vaccines on previous visits and was due for the last one. For an unknown reason, the infant did not receive the 4th pneumococcal vaccine. It was not clear from the documentation if the 4th vaccine was not available due to manufacturer supply problems, or if the mother had refused because the baby had already received 3 vaccines during that office visit. No waiver of vaccination was signed by the mother. 1 month later, the baby was evaluated for a rash on her face. The 4th pneumococcal vaccine was not given. 3 months later, the physician's office sent a form to the daycare with a notice that the baby had not received all of her required vaccinations. The mother later testified that she did not receive a letter and had not been notified by the daycare center. At 18 months of age, the patient had another well baby office visit, receiving all the required vaccinations except the 4th pneumococcal vaccine. No documentation indicated the reason. 2 weeks later, the baby became ill and was taken to the emergency department. She was diagnosed with fulminant pneumococcal meningitis. She expired 2 days later. In the claim filed by the parents, their experts stated that the standard of care requires physicians to have a system in place to notify them and parents when vaccines are overdue. He opined that the physician missed opportunities to give the 4th pneumococcal vaccine, and if it had been given, the patient would not have contracted meningitis. Defense experts stated that the vaccine could have been given at the regular 15-month visit, but the mother did not take the baby to the office then. She testified she was told that the baby did not need a visit at 15 months. The defendant also stated that if the vaccine had been given at the 18-month visit, there would not have been adequate time for immunity to build before she contracted the illness. The communication breakdown contributed to the death of an infant. The system failure points to the importance of processes that support physicians in providing ongoing care to infants.